Recently, the Veterans Administration came out with a VHA nursing handbook, and in that handbook, they eliminated physician anesthesiologist involvement in the care of veterans.
They're proposing to let nurses act independently without physician guidance. It's an ill-advised move and not in the good interest of the veterans or the citizens of the United States.
Nurse anesthetists play an important role on the anesthesia care team. However, nurses are not physicians.
Physician anesthesiologists have more medical education as well as medical training that allows them to deal with many more issues than most nurse anesthetists would be able to.
After my last shoulder surgery, they say I didn't want to wake up. They couldn't wake me up for anything. That physician anesthesiologist was right there. She was trained that in a situation like that where a patient didn't want to come out of the medication, she knew exactly what to do.
Removing physician-led anesthesia care from patients at the VA will definitely make care there less safe and less efficient.
Veterans, especially the older generation and those exposed to certain toxins during deployment, are sicker and more complicated than your average patient. Veterans have higher rates of certain chronic medical conditions like diabetes and heart disease that need to be carefully managed during surgery.
Within the OR, complications can happen, and when things go wrong, they usually go wrong really quickly.
If there's an emergency during their care in the operating room, not only can a physician anesthesiologist diagnose the problem and treat the problem, they can also do many of the procedures that are required to save the patient's life. That training is not given to nurse anesthetists.
When seconds count, physician anesthesiologists save lives.
When the VA published their handbook with the plans to implement a change and get rid of physician-led patient care, they did not ask for information or feedback from the stakeholders like the patients, the doctors who are taking care of the patients, and the family members.
I think citizens of the United States would be very unhappy to hear that veterans are getting second-class health care.
These veterans are our heroes. They have sacrificed, some of them, life and limb, and they deserve the best care possible.
The American public needs to speak up for our veterans to ensure that they receive the same high-quality, cost-effective care that the rest of America has access to.
Take action to protect veterans.